a new person in health, but that what we have done is to change the status quo of how, in terms of infrastructure, we've had ambulances in all our general hospitals in Lagos. We now have a lot of equipment, hairspray machines across the states. We also have what we call, we're planning to start the medical park coming up very soon, and we've started the process, everything is on. We are equipping our hospitals, we are upgrading the infrastructure that we have in Lasut. Now, our care house will be delivered before the end of this year, by December, by the grace of God. And we're improving on all our equipment, and we're building on our capacity on the net services in Nigeria, in Lagos State. So we're doing a lot, and we now have a policy that does not allow people to leave we want to make all our health facility a one-stop shop where they can easily get diagnosed, treated, get their drugs in our hospital rather than leaving the hospital to go and buy drugs somewhere, or they are being referred to any other diagnostic centers. So we're looking at all those things. We have started on that, and our staffs are now dealing with the public the appropriate way. Where cases of inefficiencies noticed, they get penalized, there are sanctions for it, and we also encourage them to do well by giving them necessary support, both in terms of moral support and financial support. And for us in Lagos, everybody gets paid before the end of the month. And on 25th of every month, all our staffs are being paid. And so it's another means of encouraging them. And we now have our law on the health insurance scheme. We are finalizing the technical aspect of it. We will enforce it before the end of this year, that every individual in Lagos will have an health insurance scheme in place, so that at every given time you can have access to health matters across the state.
Okay, what about the retraining of your personnel in general hospitals?
We do that on a regular basis. They have been trained and trained regularly so that we can improve their capacity and we also, we have so many other specialized disease controls that we have put in place in Lagos State. We have the TB, the HIV, centers across the state, and where we ensure that of recent we are also planning to have the law on cancer center in place. So that law is in place. We're working on the bill to make it a law very soon, and a certain place have been cited for the purpose of having a cancer center in that particular area. So a lot are happening in our centers, and we're also equipping our emergency centers across the states to ensure that in the case of emergency, of accident emergency or trauma emergency, we ensure that they are well taken care of, and we have people who have been trained for that purpose.
Are you expanding to the rural area?
Yeah, we are ensuring that in our rural areas, because there is nowhere in Lagos that we don't want to extend the health facility. We're building more health centers in the rural areas. We're also ensuring that our referrals system is strengthened so that everybody who are in the rural areas can easily access the health centers closer to them, and at the same time also have the opportunity of getting the secondary health facilities in their areas. For us in the area, our health centers, we ensure that in all 57 local governments and SCDAs that we have in Lagos State, there would be a health center, minimum of 1 or 2. At times we have some local government that they have 3-4 health centers. So we're working on that to ensure that everybody in every area is accessing our health centers.
Okay, what about the mother and child care, the internal mortality rates in Lagos State?
Yeah, well, you will also note that we have our MCC, which is mother and child healthcare centers across all our hospitals in Lagos State, where what they do purely is to take care of the mother and the child and ensure that our facilities there are also in the best first class facilities are being provided for them. So we have what we call an upgraded and a standard MCC across the state, that at every given time the mother and child can be well taken care of, and we equip it. We give them free drugs at a particular age. Before the age of 13, they have the opportunity of getting free drug, and when you're over 60 also, you can access that. That we're doing. But one of the major challenge that we do have is fund, and that's why I'm also working on a private member bill, which is trust bill, which will make it possible for us to provide health care for everybody within this state.
Okay, as honorable member of the House, you're working with the Commissioner for Health, Lagos State. How is the relationship so far?
Yeah, well, we're having a synergy. We are on the same page. We're working together to ensure that Lagosians have the best. I, as the supervising committee chair, supervising the Ministry of Health, we ensure that we work together. We sit down, and areas that we feel that we need to improve, we discuss it together. So we're on the same page at every given time to provide good health services for the people of Lagos.
Thank you very much, sir.
My pleasure.